Very well, right about now you're watching Smart 24 TV. Thank you for keeping the remote up speed across your eyes. And also, SMB continues. Right about now we're heading to our topical discussion of the day with me, Rita Cabanyoro, and we're going to be bringing to you an expert analysis from the Ministry of Health. Last week, we actually gave an highlight because there were reports that over 5,000 learners across the country from schools were actually symptomatic with COVID-19 symptoms, and whereby 917 were in isolation. Joining me now, we're going to be speaking to Jessica Nsungwa, who is the Commissioner of Child Health at the Ministry of Health, to discuss and take us through. Jessica, if you can hear me, over the 500 COVID-19 symptom cases that were reported in schools, maybe you could share with us how true is it from Ministry of Health, and if it is true, or in case this is right, which places or schools or regions actually reported these cases? If you could hear us, Jessica, please take it on from there.
Okay, thank you very much, Rita. We've been running a school surveillance system since the schools opened. We trained and prepared the schools in advance. Unfortunately, the schools have been logging on the system gradually. So what we have now is based on the schools which are reporting. So not all schools are reporting it, but every day more and more schools report. So these 5,000 children you have reported are actually likely to increase because of that. So we did expect this number, and we're going to get many more children, because basically what we are doing now is reporting on children who have symptoms. Our main concern is to monitor and see when the threshold goes high, because ideally these children can have fevers, flus, given the dust, given the weather. But when we start noticing the numbers rise very rapidly, then we get concerned. And at that point, the Ministry of Health will move in to confirm that this actually is an outbreak. We'll first of all confirm that these children have the symptoms, we suspect, but also we'll try to do the tests. We'll come in and do some confirmatory tests on these students. And then once they are confirmed, we'll also guide the schools on the management. Also, the children will have very limited symptoms, so they can actually be isolated and managed in the schools. It's only those who are very severe who need to be evacuated.
Reported to be isolated. How true is it? Were they already confirmed?
Yeah,
if you
some of them,
maybe you could tell us how about the 900, over 917 that were isolated by then. Is it true that they were isolated? And also, did you do the testing? Were they positive?
This process is a symptom-based approach. Any child who has a fever, who has a cough, who has a headache, body pains, and now more in younger children, they can also have abdominal pain and even diarrhea. We follow them up and we isolate them. Initially, we isolate them because they become suspects. And then we can only confirm when we have tested. So as I said earlier on, when the numbers increase, then we move in and do the testing. We do a confirmatory test using a PCR. And once we have confirmed, those children go on to treatment, or they get care, COVID treatment accordingly. So most of these schools you see have these cases, but not all of them have been visited, because one, the numbers change every day, but also we have made arrangements. Each school has been linked to a nearby health facility. So the nearby health facility receives information on a daily basis from the school, and the nearby health facility transmits this information to the district and to the Ministry of Health later on. So that information is just meant to trigger us. So it's a surveillance system, it's a continuous surveillance system to alert us when there's a problem. That's why when you look at all those numbers, not all of them are going to be positive. We've had some children admitted, about 16 of them have had to be moved for closer supervision in the health facilities, but most of them are being managed in the schools.
Okay, just to make us understand better so that we have a clear, your view clearly, the ones that have been isolated, like you said, have they been taken care of from school or the nearby health centers that you're mentioning on?
They are actually being isolated in the schools. We've worked and planned with the schools to create space. Some schools have sick days, but some have gone ahead to create space in places where they're not having activities. Some of them have improvised some space in the halls, in the dormitories. Some of them have improvised some space in labs which are not very used, which are not very busy. So they can have these children catered for. They are given their beds and they are fed and they are monitored by the health workers. So our health worker provides supervision, but most of the work is being done by the school. Each school has a COVID task force, a 7-member COVID task force. And this task force has a representation from the community, basically parents. So they are also informed about what is happening. And also the health facility is linked to the system. So we're really working together. We have a partnership with the school, with the health facilities, and the parents, and the community at large.
As you mentioned, are we talking about only public schools or even the private schools? You've got a set-up system there. If you could guide us through, maybe someone is watching there, they want to reach out on a way how they would be also finding the situation very smoothly in case it happens.
Yeah, each health facility has a catchment and all schools, both public and private, are linked to these schools. And actually our unit of entry is the health facility. So over the last couple of weeks, we've been training the health workers, but also training the schools. We've worked with the Ministry of Education. We've been training the district education officer and the district health teams to cascade this information and knowledge down. And this system is digitalized, as you may be aware. So information is sent real time so that we are able to respond very quickly. So far, we have not been able to have a major move from the center. So most of the work which is going on is happening at the district level. We've tried as much as possible to be centralized because at the district we have surveillance officials, we have epidemiologists, and then we have health workers who are managing the treatment centers. So we think as of now, the districts can handle unless there is a need for us to go in. But for now, we have not had how to move in from the center.
Okay, thank you for sharing there. And as a commissioner for healthcare at the Ministry of Health, maybe you could share with us on more emphasis on expertise. You're an expert there. What impact does COVID-19 leave on a child or an infant? I do not know well, you're able to share with us. When it is positive, what impact does it bring about?
First of all, I must say that COVID is a new disease. And when it gets to children, it's even much newer. In the first phase of the pandemic, when we had different variants, most of those variants were sparing the children. But right now we have a variant which is actually moving aggressively across all age groups, including children. And you know that this virus affects all organs. We have an acute phase where the patient suffers mostly because of the lung symptom, the chest symptoms, the throat symptoms. But we have also seen and discovered that actually this virus can affect your heart. You get a myocarditis, it can affect your kidney. We've seen people who have developed diabetes, and that means their pancreas is affected. Some people have also had some muscle problems, long-term muscle weakness, including memory issues and attention issues. Some people have had drowsiness and so on. So those symptoms tend to occur across the board. And some of these are prolonged, because that's what we call long COVID. But we are yet to know what happens several years after. We are mostly, for children, worried about complications with the kidney and the heart. But there are systems we have put in place to follow up these children. And since it's a very new situation, we don't have much data. But we're going to do some long-term follow-up. In other countries like the US, they are also following up, and we are also borrowing information from other countries. And we will be following up these children because this is a new episode, a new pandemic, a new variant, which is affecting children across the board. I must say that the cases we are seeing in Uganda among the children Most of them are affecting children between 15 and 20 years. For those who are younger than that, we mostly have children who have problem.
I
We have
have
children.
lost you around there, but surely you're going to start from there. I do not know if you can now hear me. I think your network is now back. If you could share with us, maybe continue from there. You were still telling us about the most affected being between 15 years and 20 years. But my question is around there. How is the response or the feedback from those that are vaccinated between 18 and above as you take it on from there? Jessica.
To inform you and the general public that most of the people who are dying, the majority of patients who are dying have not been vaccinated. We have very few people who have been vaccinated who have died. And most of those who have been vaccinated who have died, we have discovered that they were due for a booster. So after some time, after 6 months or so, the immunity wanes, and these people, especially those at risk, require a booster. So most people who are immunized have not been dying. For children in that age group, I was just telling you that we are also losing children slightly younger, but most of those have a comorbidity, have an underlying problem. We have kids with kidney disease, with heart disease. We have those who have some HIV is a big problem. Tuberculosis has also been one of the cases we have seen as an underlying problem. So those people are already compromised. So when they get COVID, they easily die. But as I said, that age part, which is mostly affected among the cases we have lost, is mostly between the adolescents, mostly the young adolescents who are dying also in the communities and in some places where we have cases we have documented.
Okay, and just to add on that one, as the ministry and also as a commissioner of the child health, are you only looking at COVID-19 from schools or improving the health of learners and also children? Or any strategies that you have laid to make sure you also tackle other health issues in schools? Or this time it's only COVID-19?
Actually, our primary interests as far as children are concerned, even when the pandemic has been running, was to make sure that services, essential services continue, because we lose more children from malaria, from pneumonia, even COVID. So our main emphasis has been to ensure that services continue. And we've been monitoring. We have weekly meetings where we look at this, the utilization of services. We look at the availability, the stock of medicine, and we tend to respond because we knew that pandemic actually stretched our capacity, stretched our system, and most attention was driven to COVID. So we are very much interested in other conditions. We're interested in children who have comorbidities. We have now begun moving with vaccination programs in special clinics in hospitals. Many of them have special clinics for heart problems, for TB. We are really now targeting those clinics, but also educating the communities. And even in the schools where they have data, we are moving in to vaccinate these children during the campaigns which are going on. So we're very, very much interested in making sure that these children don't die from other problems as a secondary impact of the COVID. When you have COVID, children tend to take the face of COVID, both health-wise, but also psychologically. They are traumatized. Most of the information doesn't target them. Some of them have been orphaned or they've had to deal with sick people in the home. So we have a lot of issues and concern about the mental aspects. We have also mental programs and counseling programs we're doing for these families.
And just to give more insight, is the facilitation there actually? Is it reachable? Is this a reality to some schools across the entire country, even deep down in my villages? Because we have seen cases where actually some reports indicate that, you know, the works of the ministry are not visible there. What is the capacity of the ministry?
Yeah. I think one of the advantages we have had, as I said, concerning children, is the fact that the earlier phases of the pandemic was not really directly affecting children, although they, as I said, they had other effects, secondary effects. So that allowed us to prepare. We built capacity countrywide to be able to treat COVID, and that capacity has been a strength for us. We are working very close with the Ministry of Education. We have a strategic meeting where we meet both sectors, but also within the sectors, we have individual activities which are going on. On a weekly basis, we discuss schools. We're scaling up the training, we're scaling up the mentorship of the district teams. And as I said, our main emphasis is to run a decentralized system. We want as much as possible to have the response at the point of care in the districts, not at the national level. We want to have it in the communities. And when you move down in the districts, the district health teams have now trained the lower level health facilities. Some people may not be aware. We have trained health workers and community health workers actually to pick information for surveillance. And we have developed a digitalized system with the Ministry of Education and our partners, which we have rolled out. And we're encouraging more and more schools to use this system. Go to the nearest health workers when you have an issue, and this information will be sent upward to the districts. And also, we are compiling this data. We have what we call an incident management team at the national level, but we also have district task forces, which are multi-sectoral, working with different sectors, education, Ministry of Gender, and they are ready to support the schools and also work on the referral system. So you may not be seeing it visibly, but most of these health units are ready to receive information from schools, but also to go and support them, both in responding to the schools, but also training them. We have enough testing kits to test the schools now. We have procured enough testing kits, and we are going to be doing that. We are also working on the vaccination of teachers, but also children with comorbidities. They need to be vaccinated. Even if they are below 18 years or 12 years, we are actually targeting them for vaccination. And we give them Pfizer. Pfizer is the basic vaccine, which is suitable for children. So we are encouraging all the schools to really register and share this information with us so that we can come in.
Well done there, by the way, Jessica. And just to, add on more, just like you said, you're in cooperation and coordination with the Ministry of Education. If you could, if we could speak about numbers here, maybe on a weekly basis, how many reports come from schools? I mean, COVID-19 symptoms or the situation, or even health-related issues in children. How many do you receive weekly or even daily?
Yeah. We are taking, as I said, it's been a gradual process. Many schools, when the schools opened, they were overwhelmed, sorting out schools, setting out structures, making sure that they have the SOPs in place. So the registering on the system has been a gradual process. But I must tell you that this week alone, the numbers have increased. In the first week, we had 216 schools report, very small. But since then, the numbers have increased. And tomorrow, we'll be meeting again to see. Every Tuesday we take stock. We compare the numbers. Now we have schools in thousands now which are reporting. Some regions are doing much better. We have schools like in the south, in the central Masaka region, that area, we're seeing good reports coming up. And we have also good reports from the southwest, especially where we have been doing the campaigns and supporting the districts to ramp up the issue of vaccination. We are seeing that people are more apprehensive. Ministry of Education, however, has worked through their PTCs to make sure that we have centers all over the country where we have trained trainers and mentors to support these schools. And already we are seeing results. So tomorrow, we are expecting them to have much more, many more schools reporting to us. And as I shared, it's a shared responsibility between Ministry of Education, the parent ministry, and ours we come in to support on the response. And Ministry of Education now is the one running most of the scale-up trainings on surveillance. We come in for the response mostly.
Well, and we'll be also reaching out to the Ministry of Education. We tried to reach to it, but unfortunately, they could not speak to us at the time when we need them. Maybe, hopefully, we'll still try our means to speak to them. But still on health care of children or child health, what do you have to say about the increasing cases reportedly that there is mental disturbance within our children? What maybe do you have to say about that? Is the ministry looking at it as an issue that is actually going to go viral? Maybe it could even overtake COVID-19. I do not know what your reports say. You can start from what your reports actually are indicating statusly currently.
out there secondary to COVID. We have children who have directly been involved in the COVID, either because they've fallen sick themselves, and the issue of fear of death, death which they can't understand most probably, or they've had to deal with parents, or they've actually been orphaned, or they've lost siblings. So we have children who have been directly involved. And we have teams in the districts there which have been visiting some of these families as a follow-up to be able to support them, and including the community health workers who have been trained now to support these families. So we have a system which is more directly involved, and they are running a program called home-based care. They are given both information, but also they're also given a treatment kit, and they're supposed to follow up these homes and support them to recover from this situation, but also support them to understand that there's an impact, which could be a longer-term impact, and the children need to be supported. But we also have children who have not been directly affected, but because they see, they hear, they watch on TV, and we are trying to increase the messages, infographics, which can communicate to these children. And that's an area we want to work with the schools to make sure that on the curriculum and assembly that teachers are talking about these issues, children can ask questions. So that component we are mostly working with through the media, through the communication, but also through schools to make sure that we reach the general public, the general team of children, working through people who spend more time with them. So we have also provided materials, IEC materials for the schools, and distributed them to the teachers.
The feedback of the Ministry of Health from the recent immunization carried on about polio. Maybe how did the exercise go? If you could give us the general overview of what happened and maybe the effect of that immunization. I think I've lost you there, but I would really wish lastly you could share with us what the assessment you did after the immunization of polio recently that we had around the country.
Yeah, it's very unfortunate that polio came back because we stopped vaccinating against polio several years ago, but recently we had a case from the samples. We do samples, we have a surveillance system which continues to sample just in case we have cases, and recently we had a case, so we had to run a polio campaign. We had to stop the COVID vaccination to be able to run that campaign so we don't have an overlap, and we had an overwhelming success, We had more than 90% response, and this has been a very important thing because earlier on, we were worried that the combination of the run on top of another vaccination program would have negative consequences. But we had a very overwhelming response. The district system and the logistics management and organization was very impressive. And I want to thank the local governments because most of this work happened because of our local government teams. They had their data, they had their numbers, they had their systems ready, and they went out to do outreaches and make sure that they reached every house. They went house to house to mop up all these children and get them vaccinated. So we had a very successful program and very good value for money.
Okay, that brings me maybe to the last one. How valuable is money in the Ministry of Health? How valuable is it? Because every time at least we see the 70% is coming from donors, is coming from well-wishers. So how valuable is money and also funds around the Ministry of Health?
Okay, we like many countries were not prepared for the pandemic, this COVID pandemic. And more so because most of the things we required are not manufactured here. Be it the tests initially, but now we are actually producing them now here. The medication, but of course, now there's work going on, research, including the COVID effort, but also the vaccines have not been produced here. And not many countries, even the developed countries, not many of them are actually able to produce them. And that's why we had a problem. We had to line up and queue for this vaccination. So for the pandemic, mostly, in terms of the things we needed to use, most of them came from outside, but we have long-term plans the government has actually invested money in research, including vaccine production. And I think soon you'll be hearing more and more from that research, which is going on to do locally, to produce vaccines locally. But I want to mention that this pandemic, most of the operational money, including the money which has bought vaccines, came from the Ministry of Finance. Along the way, we received so many donations, but the testing kits, the equipment here in the hospital, the support we are giving to the schools, the capitation grant, most of that money is from the government of Uganda. And like many countries have had to reorganize their finances to be able to support these activities. And compared to other interventions, I can assure you that most of the support for COVID has come from government. It will definitely have an impact because we did not prepare for this 5 years ago. But I think there is going to be a continuous process to make sure that we adapt within the process and make sure that we're not affecting many services. The economy has been hit hard as a whole, so definitely it would take us some years to readjust. But the government has been very supportive and very committed in this process. And we want to thank the leadership. The highest level of the leadership has been exemplified in this process.
And surely I would let you go for now, but because the border is open, the Gatuna border between Rwanda and Uganda is open, we couldn't just walk away without this one. As a ministry, is there any plans of maybe foretelling of what happened around the Kenyan border? Is there any plan that the ministry could maybe draw charges for COVID-19 testing around the border now that it's open? What is the anticipation? What should people expect at the border in regarding of health-related issues now?
One thing I must mention is that we handle all borders using the same system. Actually, we handle the border activities as a block, the East African Community Bloc. And that's why you see when there were concerns at the Busia border, as an East African community, we had to convene and we made decisions which were suitable and acceptable for the whole region. So what is going to happen in Katuna is what is happening in Malaba, what's going to happen in Amuru, and so on and so forth. So we're applying the same system. We currently now, what we are doing, we are recognizing tests from other countries. Previously, what was happening is that when these traders came in, or truck drivers mostly, we had to test them again. So currently we're not testing them again, but we have a system. The East African Committee has developed a networked system which can compare all these results, can put all this information in one system. That means we are able to verify and be able to share information in the region. So Katuna will be handled like any other border. And we want to thank Rwanda for this positive move to make sure that as a body, that we are working as a globe, as a cluster, and we are looking forward to catch up with other economic activities across the border. We really welcome the idea.
Okay, thank you so much, Jessica, for your time right here and joining us to share more insight from responses of the Ministry of Health. I'm Rita Cabanyoro, and more is coming up on SMB shortly after the break.